Thank you, Dr. Block. It's so wonderful to be here with you and with Dr. Gifford and Director Stenning and all of the great supporters of this work, Steve O'Rourke from the Providence Housing Authority, and particularly I want to recognize Caitlin, where is Caitlin, for her incredible work, and I want to talk about her in a moment. But I'm very happy to be here to announce with Dr. Gifford this $3.3 million federal stimulus grant awarded to the Mayor's Substance Abuse Prevention Council in partnership with the Rhode Island Department of Health. So, big round of applause. $3.3 million. This was a very, very competitive process. A very small number of sites around the country were funded, and this is really a tribute to all the great work that's being done. These federal dollars will fund the launch of the Providence Tobacco Free campaign. It will create 15 new jobs as our community partners hire organizers to move this campaign forward. And this is really about putting people to work right away while improving public health. Two great objectives are being met with this grant. The Providence Tobacco Free campaign is a citywide tobacco prevention initiative designed to stop young people from beginning the dangerous, highly addictive habit of smoking. This campaign will be carried out in partnership with community-based organizations that represent disparately impacted groups of young people. I really want to commend the Mayor's Substance Abuse Prevention Council and particularly the leadership of Director Caitlin Thomas-Henkel for their hard work in partnership with Dr. Gifford's team in the Health Department to secure this grant. It's really a great example of the power of partnership, and that hard work pays off. So again, congratulations and thank you. I also want to thank our congressional delegation for their continued support of our efforts not only to improve public health, but also for their efforts to target stimulus funds to Rhode Island to put people to work, invest in our communities, and build a stronger, healthier future for everyone. So thank you to everyone. Congratulations. And now it is my great pleasure to introduce our great partner, Dr. Gifford, who will explain the campaign more.
It is very exciting to be here today to talk about probably the number one issue that is impacting the health and safety of all the Rhode Islanders, which is tobacco and cigarette use. We know that the cigarette companies are targeting many of the residents in Providence, many of the residents in the state. They're particularly going after kids. They are putting stores and advertisers close to schools. They're selling the loosies. They're doing a number of different ways to really get kids addicted early on because it's a good business model for them. You have someone addicted early and buy your product for the rest of their life. That is a good business model. And we need to be taking action against these large corporations that are really sort of taking advantage of our citizens in the state. And so it's this type of stimulus funds that are going to be really helpful for keeping people safe. Not only is it through education, but it's going to be working through housing. It's going to be working through looking at limiting where cigarettes can be sold. The problem is they make it easy for our kids, easy for adults to buy cigarettes. We need to make it harder to buy cigarettes. We make it easier to do the right thing, harder to do the wrong thing. And I think that's really the effort. I think the mayor really alluded to it, that this really is a partnership. In Rhode Island, we have no county or city health departments. The only other state that shares that distinction is the other island state of Hawaii. And so we are Providence City Health Department. We are Woonsocket's Health Department. We are Cranston's Health Department. We are Westerly's. We're Newport's. We are all of that. And we work very closely with the cities and towns to address that. So we really look forward to working with the mayor and his team on addressing that. The team from the health department is here. I see back there Lisa, Jan, anyone else from the health department back there? Yep, back. A number of people back there. This is really a team effort. It's not there. I see the American Lung Association and a number of other different groups are here. This really requires working together to address that.